Welcome back to the deep dive. Today we're jumping into a really high-stakes area, looking at one of the most critical roles in modern pharma success. That's the drug metabolism and pharmacokinetic scientist, or DMPK for short.
That's right. Often misunderstood, but absolutely crucial.
Yeah, exactly. So if you are maybe tracking the huge growth in biotech, or perhaps you're thinking about where to focus your own scientific career for, maximum impact, then this deep dive is definitely tailored for you. DMPK, it's really become the cornerstone, hasn't it, of modern drug development?
It really has. It provides those essential insights into ADME, that's absorption, distribution, metabolism, and excretion, how a drug moves through the body.
And that work, it guides basically everything, from tweaking a compound structure right through to getting those major regulatory approvals.
Absolutely. These scientists, they're essentially the gatekeepers for safety and efficacy. And what we're seeing now in 2025 is this dramatic strategic elevation of the role.
Okay.
The demand for experienced people, especially mid-career folks, it's never been higher. It's creating this really intense global talent war.
A talent war.
Yeah. So our mission today is really to give you a kind of strategic roadmap to help you understand this market, highlighting the most important skills, the biggest trends.
Okay, right. Let's unpack that shift then. Why are these specialists suddenly so indispensable? I mean, you've got large pharma, fast-growing biotechs, all fighting tooth and nail over them. It feels like more than just, normal demand increase. It seems systemic.
It is systemic. The pressure on the whole industry is just relentless. Deliver safer therapies, more effective ones, and do it faster.
Always faster.
Always faster. And DMPK expertise is sort of uniquely positioned to bridge that really dangerous gap between discovery research, the exciting ideas, and full-scale development, the bit that costs a fortune.
Right. They're informing that critical gonna-go decision.
Exactly. And often before hundreds of millions get poured into a project, that leverage is huge.
That leveraged impact. Yeah, that makes sense. And we're seeing what, like 4 big forces kind of converging right now, pushing up this demand?
That's a good way to put it. 4 powerful drivers.
Okay, so let's start with the drugs themselves, the complexity.
Right, that's driver number 1, complex new modalities. Maybe 10 years ago, DMPK was almost all about small molecules, the traditional pills. Now, they have to apply all those same rigorous principles across this radically different landscape. We're talking biologics, peptides, even highly specialized things like gene and cell therapies.
Wow. So that immediately demands a much broader knowledge base from the scientists.
Much broader, more multidisciplinary. And then there's the regulatory angle.
Ah, yes, the second driver. Model-informed drug development, MIDD. This is where it gets really interesting, you said.
Yeah, because regulators globally, they're not just sort of passively accepting this kind of data anymore. They now explicitly expect submissions to be supported by sophisticated PK/PD modeling and simulation.
So it's gone from nice to have to must have.
Absolutely. It's basically non-negotiable now for demonstrating safety and predicting dosage.
And that expectation, that then feeds the third driver, right? The early safety call.
Precisely. Early safety decision-making. Because we now have these advanced models, these predictive insights, DMPK data is informing those really critical pipeline decisions much, much earlier than before.
Which means fewer late-stage failures, hopefully.
That's the goal. It minimizes those hugely expensive late-stage flameouts, making the DMPK team's input incredibly high impact, incredibly valuable.
Okay, and all this is happening while everyone's expanding globally. That's the fourth driver.
Yeah, global expansion. We're seeing massive growth in biotech clusters everywhere, across the US, Europe, Asia.
So you put all that together.
Right. You factor in the rise of these new complex modalities, the higher regulatory bar, and the global expansion. You've got every major R&D hub fighting fiercely for the exact same very limited pool of experts.
So stepping back a bit, the result of all those drivers, those 4 things, is that the DMPK scientist isn't just, running tests in a lab anymore. They're more like a strategic consultant.
That's a perfect description. Strategic consultant.
So if the job itself has changed so much, what specific skills are employers really prioritizing now in this super competitive market? Must be a mix, right?
Yeah.
Deep technical knowledge, but also that agility.
It absolutely is. You nailed it. While the role's definitely more strategic, you cannot ignore the technical foundations. They're still paramount.
Okay.
For anyone listening, if you want to thrive in this field, mastering certain tools, certain methodologies, it's just essential.
So if you are that candidate, maybe listening now, trying to get to the top of the market, what's the non-negotiable technical checklist?
Okay, let's break it down.
First up, I'm guessing, is deep competence in developing and validating methods using LC-MS, liquid chromatography, tandem mass spectrometry.
Spot on. That's the absolute workhorse of the field. So that expertise is table stakes, really. But crucially, you have to pair that with a strong grasp of in vitro and in vivo ADME.
Right, test tube and animal models.
Yeah, and clearance prediction. Being able to predict how a drug will behave in the body using both those types of models, it's foundational.
And related to that, I suppose, is understanding the breakdown products. Metabolite identification using advanced MS tools.
Critical, absolutely critical. Understanding exactly how the body metabolizes a compound, identifying those metabolites, that's key for flagging potential toxicity or even efficacy issues way upstream.
Okay, and tying back to what you said about the regulators.
Yes, the PK/PD modeling and simulation piece.
Yeah.
Strong experience there is now a must-have. That's how you generate the predictive data that MIDD requires. No getting around it.
So those are the core technical skills.
Yeah.
But you mentioned the shift towards these new types of drugs. What are the really hot specialized areas employers are hunting for?
Well, the biggest pivot right now is definitely towards large molecules. That's where the pipelines are increasingly heading.
Okay, so what does that mean specifically?
It means candidates need concrete DMPK experience with things like antibody drug conjugates, ADCs, those highly targeted delivery systems.
Right.
And also with oligonucleotides, the ones that work on genetic expression. The industry is moving fast into these areas, so the talent needs to follow, but that specific expertise, it's still pretty scarce.
Okay, so we've got the scientific depth covered, but what about the other stuff? The non-technical skills that really make top candidates stand out. It can't just be about the lab work anymore.
Oh, far from it. That strategic consultant role we talked about, that requires more. A big one is substantial regulatory submission experience.
Meaning actually preparing the documents.
Preparing or contributing heavily to those key regulatory packages. We're talking INDs, the investigational new drug applications to start trials, and then NDAs or BLAs for market approval. That experience is gold.
And presumably talking to other teams.
Yeah. Vital. Communication and increasingly leadership within those cross-functional teams. The DMPK scientist has to explain complex data clearly to chemists, to clinicians, to regulatory affairs folks, people who don't have the same deep DMPK background.
So they need to influence decisions across the whole R&D chain.
Precisely. They're translating the science into strategic implications.
Which makes the role incredibly valuable, like you said, but also sounds extremely difficult to fill.
It is.
Let's talk geography then. If this talent is so rare, where are these professionals actually concentrated right now? And where's the fastest growth happening? This is where it gets really interesting for hiring managers, I bet.
Yeah, the landscape is pretty defined. It's dominated by about 5 major regional hotspots that really dictate the hiring trends.
Okay, let's start with the biggest one, I assume. Boston and Cambridge, Massachusetts.
Yep, no surprise there. That remains the undisputed global epicenter, just the largest concentration of DMPK professionals anywhere.
Right. Then heading west. California seems key.
2 major hubs there. San Diego is seeing incredibly rapid biotech expansion, which is driving this really strong surge in particularly mid-level hiring.
Okay.
And then you've got the San Francisco Bay Area. There, the demand is fueled heavily by all those discovery stage companies, the startups constantly launching new things.
Got it. Then back east, but further south, Research Triangle Park, RTP in North Carolina.
That's right. RTP functions as this highly collaborative hub. You've got major CROs there, big pharma presence, all working closely together.
Okay, Boston, San Diego, SF Bay, RTP. What about your emerging areas?
Well, what's interesting for maybe future decentralized growth is the focus on some Midwest hubs, places like Chicago, Indianapolis, St. Louis. They're being identified as these sort of critical centers for future DMPK expansion.
Why there?
Possibly driven by, lower operating costs compared to the coasts, plus strong academic research centers nearby.
Okay, so that's a lot of activity, a lot of regions, all chasing what sounds like a pretty small group of people.
Exactly.
Which raises a big question for me. If the industry is relying so much on these existing small molecule experts, mostly in these hubs, how realistic is it to expect them to just pivot to biologics overnight? Doesn't that just stretch the talent pool even thinner and make the shortage worse?
That is the absolute core conflict playing out in the market right now. It leads straight into the biggest hiring challenges. That skill evolution gap you mentioned, it's very real.
So companies want biologics experience, but the pool is mostly small molecule.
Largely, yes. and transitioning a seasoned small molecule expert to become truly competent in biologics DMPK. It takes time, it takes significant investment in training, and frankly, few companies feel they can afford the pipeline delays while that training happens.
Which creates this bottleneck.
A major bottleneck. It creates what's effectively a talent shortage right at that crucial mid-career level. These are the people with enough experience to lead projects, but they still have that hands-on technical mastery.
The sweet spot.
The sweet spot. And everyone wants them. It's like trying to find a very specific type of engineer during a gold rush. Everyone knows exactly who they need, and they all need them right now.
And they're all competing. Pharma, biotech, CROs.
Yes, that cross-sector competition is fierce. Large pharma, nimble biotech, high-volume CROs, they're all fishing in the exact same, relatively small pond. It just cannibalizes the resources.
And the result of that intense fight must be turnover.
Huge retention issues, absolutely. High turnover is a major problem, and it's being driven by competitors throwing around not just higher salaries, but really aggressive equity packages.
Yeah.
And critically, flexibility.
Flexible work models. That keeps coming up.
It's a huge factor now.
Okay, so if that's the challenge on the supply side, what are the smartest companies actually doing to win this talent war? They must need a really clear strategy, right? To attract and then keep these key people.
Yeah, winning definitely requires agility and some strategic shifts. One key practice we're seeing is companies starting to expand their candidate criteria, meaning they have to look beyond the perfect DMPK profile. Look at adjacent scientific backgrounds, maybe someone strong in toxicology or analytical chemistry, and then actually commit to training them for the specific DMPK knowledge gaps, rather than just waiting forever for that unicorn candidate.
Okay, be willing to invest in training. What else?
Speed. Crucially, streamline the hiring process. It has to be faster. Top candidates, especially the ones with that coveted biologics and regulatory experience, they can be off the market in literally a matter of weeks, sometimes days.
Wow.
Yeah. So companies that drag their feet on interviews, on feedback, on making an offer, they just lose out immediately. Speed is a massive strategic advantage here.
So get nimble in HR. And once you hire them,
then you need to invest deeply in retention. It's not just about the initial offer. Things like strong mentorship programs, really clear paths for advancement, making sure the DMPK role is visibly recognized as strategic, not just a support function. That all helps reduce turnover.
And the big one you mentioned, flexibility.
That's often the major differentiator. Emphasizing hybrid flexibility, sometimes even fully remote where possible. That flexibility is frequently the actual tipping point when a top candidate is weighing two otherwise very similar offers.
It shows trust, I suppose,
Huh.
and maybe acknowledges the high-pressure nature of the work.
Exactly. It signals trust and a commitment to work-life balance in what can be a very demanding field.
So if we put all this together for you listening, the candidate,
Yeah.
what's the big picture?
Well, the big picture is that this environment right now represents an era of pretty unprecedented opportunity for you, the skilled DMPK professional or aspiring one.
If you have the right skills.
If you invest in developing those most sought-after skills we talked about, PK/PD modeling is huge, advanced LC-MS/MS expertise, and crucially, getting exposure to and knowledge of biologics DMPK. And if you can clearly demonstrate your value beyond the bench, your communication skills, your cross-functional impact, then you are positioned extremely well in this market.
Positioned to command both strategic importance within the organization and, presumably, premium compensation.
That's generally the case, yes.
Okay, so that's really the core takeaway then. The demand for DMPK professionals isn't slowing down, it's only going to intensify. As drug pipelines keep diversifying towards these complex large molecules, as global regulatory expectations keep rising, these professionals are just fundamentally indispensable to the success of pretty much every major R&D organization out there.
Indispensable is the right word. And maybe here's a final thought for you, the listener, to consider as we wrap up.
Go.
Given everything we've said about hybrid flexibility, how it's now actively driving both retention and turnover, how do you think this increasing reliance on remote work, on flexible models, is going to reshape the actual geography of R&D? And the collaboration methods teams use in the future? Could this talent war eventually decentralize R&D significantly, maybe pulling specialized teams away from those traditional high-cost hotspots like Boston or San Diego?
That's interesting. Will talent distribution follow the flexibility trend?
Something for you to mull over until our next deep dive.